So this is what the patient's actually going to see when they pull up their alert. And what's interesting is that you can see that identify the pressure points, and you can see that it's a live pressure map, which shows the foot motion and distribution of the pressure itself, which is very, very cool. And then what I have is the patient stand there and say, hey, listen, can you see? And it's interesting because I have a real time and I can tell the patients, and you can see they're blown away. So it enables us to have a little bit of power and a little bit of ability to understand, hey, you got to do what you got to do in terms of staying off this foot. Next slide. So the real-time alerts. So what happens? Empower the immediate behavior for the patient to get involved. So we have the patient walk for a couple minutes while viewing the affected region. Okay? We then have the patient take and sit down for about 2 minutes and taking pressure off their feet. One thing too, one caveat is make sure that the shoelaces are not too tight, because we don't want anything to affect that or put unnecessary pressure that's really not accurate. So check the footwear, tight laces, objects, rocks. You'd be surprised how many rocks that I have found with shoes that cause ulcerations. Take it out. And what's nice is we've really never had that technology before to identify rocks and foreign bodies and these kind of things in these patients' shoes that these patients don't even feel. We're talking about slippers sometimes. It's easy as that. Put the insoles in the slippers. Okay, whatever you wear the most of your time, do it. So you're going to expect the foot for cuts, blisters, redness, swelling. What this equates to, and as we've got to number 4, this equates to an office visit, in my opinion. Okay, this equates to my nurse saying, hey, you know what? He's probably going to want to see you. Okay, because these high-risk patients with these high-risk limbs need to be seen immediately, and all my patients understand that with these diabetics. So once you reach to 3, maybe probably 4, okay, they're coming in because my nurse is identified. We're going to contact them, and we need to prevent the ulceration from getting to that point. So, and then the contact support is going to for further guidance, and we get a hold of them. Next slide, please. So what's really cool, and you've seen real world information and real world a lot through the presentation. It's exactly what that is. It is cutting edge. It is right at your fingertips. And how many times and how many hours a week these phones monitor how much we're on our phones. We're on our phones all the time. Okay, gives you total alerts. It tells you what percentage of the time you've been in this pressure zone. It tells you how many steps that you've been taking, and what's nice for us is how many hours of use. Because how many times, one thing I've learned as I'm heading into my 18th year, I know I look young, that that patients inevitably don't necessarily say the truth all the time. So this enabled us to have the ability to check exactly what they're saying, which is pretty nice, and actually guide us towards more of a treatment plan. And because maybe sometimes they're not able to wear these necessary hours for whatever reason. So let's work together and see that we need to do that.